Right now, at this moment, one of my closest friends is in the emergency department. She has cranial cervical and Atlantoaxial instability. The emergency department isn't the right place for patients like us. That said, she's been battling to try to get support for this past year since she got diagnosed. Her symptoms have become severe. The reason she's in the emergency department today is she's been seeing a multitude of specialists, and those specialists are really, really worried, but she still hasn't been able to access the right type of care or support. They're at a loss on how to help her. What she's done is she's going to the emergency department with a binder in hand full of her testing, letters of support from specialists, and just trying to get help. Without neurosurgery, my friend won't make it. But there are many people out there who, if they have access to diagnosis and care sooner, they can protect their neurological structures, and they probably will have a lot of other options. For some of us, surgery isn't an out, it's the only option. It was the only option for me. It saved my life, and I'm very lucky that it saved a lot of my function. My friend needs her life saved, and that should be the hardest part. But in Canada and elsewhere around the world, because there's such a lack of knowledge about these conditions, because there's such a lack of access to care about these conditions, one of the hardest parts is how hard she's having to fight for it. There's a lot of other patients I've learned of that without traveling out of country for specialized operations, they're not making it through. That's just it. That's just all of what I know so far. I'm really hoping my friend gets through it. But at the very least, we need to make sure that those who come after us have safety, have treatment, have hope. We need to do what we can. I'm gonna believe my friend's gonna be okay, but we don't get to know that. This condition is really serious. But I'm hopeful that if we advocate, we talk about it, we can create change. People with CCI and AAI at any stage, we need help, we need hope, and we need direction, and we need to talk about CCI.